Hi again, I'm Jenny Stevenson from the Bernstein Institute, here with my partner Hello Levy, to bring you more information about our new program for family caregivers, Lynn's Legacy, Caring for the Caregiver. Today we want to share some important information. This is maybe a little bit more serious topic because it can have serious consequences, and that is how to, what we call, advocate for the person you're caring for. This has to do with, for example, visiting the doctor to hear specific information, or to work with the doctor to make sure that the person you're caring for gets the kind of care you know is appropriate for them. Mm-hmm. Sometimes that's straightforward, and sometimes there can be some issues that you really need to tackle.
Yeah, absolutely. And I am thinking right now of a particular issue that occurred towards the end of Lynn's life, and we had a whole group of people around her bed, and there was a lot of talking going on, quietly, but talking going on, and the subject came up about her end of life and her, being close to death.
And this was around the potential of whether she should get a COVID vaccination.
Yes.
And then came up with, she's near to the end, and is this really what we want to do?
Oh, yes. And it just, I know Jenny kind of had a little bit of hesitation, and I did too, but neither of us really said too much at the time. We should have. But later we talked about it and said, that was not correct. That was not right. And we had to deal with doctors, and we had to deal with the nurses and so forth, and explain to them that this was something that should not have been talked about. Anyway, being an advocate is something that's really important, and I can tell you that so often the person you're caring for or your loved one, really, you need to be able to speak up in front of doctors. You need to ask questions. You need to really be able to pinpoint what's really going on, because so often your loved one and the person you're caring for just doesn't quite have the ability to do that. And there's so many different issues that come up.
One of those is that you know your loved one better than the doctor.
That's
and yet
right.
Doctors can feel intimidating, like an authority that you must follow no matter what. Mm-hmm. And caregivers need to trust themselves that they do know something about the person they're caring for, and have a right to speak up and ask for a modification if what the doctor's recommending doesn't sound right.
Yeah, absolutely.
It takes some judgment and some confidence.
Yeah.
And this is not a simple thing, but it's very important, and it will definitely be a part of our program.
Yes, definitely. We can help to coach, train. We can certainly act as mentors in this regard if it's something that you happen to be having a little difficulty with. And so we just know that it's extremely important to be an advocate for your loved one.
So we would like to ask you again to please consider supporting us as we're starting this very important program, Lynn's Legacy, Caring for the Caregiver. The Bernstein Institute will be sponsored by Sonoma Coast Trauma Treatment, a local 501c3 public charity. Their website is sctraumatreatment.org, and right away, if you go there, you'll see a donate button. We would very much appreciate your support. Thank you again.